requiem for my disease. So I'm paging Dr. Steve.
Dr. Steve.
Take a countful. Do the little brain. I need some suction. In the carotid.
It's wow, what an intro. It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred, the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And, yeah, that's all we got today. It's just you and me.
That's us.
Right.
Old school.
Hey, before we go any further, we are not your medical providers. Take anything you hear with a grain of salt. Don't act on anything you hear on this show without talking over with your healthcare provider. If you want to send in a question, send it to, what is that, 347-POO-HEAD. 347-POO-HEAD. And you can leave us a question. And, of course, I'm temporizing because I forgot to bring up the script, and I forgot to bring up 347-POO-HEAD, so
you're doing this all from memory. That's pretty impressive.
yeah. Well, after 20-some years of reading the same bullshit.
Years of reading the same bullshit. You'd think somewhere in that brain would be a...
Well, we do have your phone calls. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Do you still have the CBD nasal spray since we just did an ad for it?
Oh, yeah.
Okay,
Absolutely.
good deal. All right. All right, my friend. I want to remind everyone to go to stuff.drsteve.com and pick up a copy of Dabble Dice. I'm retiring from the Dabbleverse altogether.
Uh-oh.
And so all of our Dabbleverse related products, games, Wet Brain, Dabble Dice, are all on sale for cost. It's what you're getting it for is what I paid for it, because I got to get out of this.
I was going to say that's brand new because I tripped over 17 boxes of it coming up.
Yes, so I got to get rid of them.
I got to get rid of that. Yes, please.
But they were selling fine, and I had a decent profit margin on it, selling them for $10. So they cost me $3.50 or something like that. When you include shipping from China.
You're right on. Yep.
And that's what I'm selling them for. It's $3.50. And then the Wet Brain, those were expensive.
Mm-hmm.
I used to sell them for $25 or $30, so I could make $5 or something.
Yeah.
So I'm selling them for $20. And once they're gone, they'll be gone. Wet Brain, I've only got a few left. Dabble Dice, I got plenty of those. So if you want to give them out,
get them now, baby.
For your
Christmas
friends at Christmas.
That's
You can
right.
buy 10 of them.
It's the perfect Christmas gift. I've never seen a
It is
better gift.
it's a fun party game.
It's a fun party game.
All right. I wanted to, Dr. Scott, herpes is bad, right?
Oh, yeah.
Well, the herpes virus itself can be used in cancer treatment. And I'm putting up on the screen, but for people who are not watching this video, a mechanism of inducing anti-tumor immunity. It's pretty cool. So they have these genetically modified herpes viruses, and they selectively infect and replicate in tumor cells.
Mm-hmm.
And then the infected tumor cells undergo cell lysis. In other words, they break apart, and they have immunogenic cell death, and that involves alterations in the composition of the cell surface, and they express different proteins like calreticulin, and there's release of damaged associated models and ATP and other things like that. And then these changes recruit and interact with receptors expressed on cells that recruit them to the tumor site, to white blood cells and stuff, to process and present tumor antigens to other cells, which then go, hey, what the hell? These things aren't supposed to be here. Mm-hmm. So the virus starts this cascade that causes the white blood cells to now be able to recognize the tumor, and then they just go in and kill the whole thing. So this, genetically modified herpes virus, little. I mean, I've seen I Am Legend. That's a little bit scary, but the ability of these things to infect tumor cells and not cause herpes
Yep.
is pretty incredible.
Pretty awesome.
So, it just goes to show you can learn something from anything, and you can use almost anything as a tool if it's used correctly. Heroin was developed as a pain medication for cancer.
Yep.
It just got out of hand.
Just got to, like a lot of other things.
Right. And so we're not using it anymore for pain, but we could.
Well, cocaine.
Yep.
Yeah.
Yeah, no, cocaine's a hell of a drug.
That's a hell of a drug.
And we use it in ear, nose, and throat to dilate nasal passages when you're sticking and numb them up. So while you're sticking a fiber optic tube down your throat,
Yep.
Through your nose.
It's crazy.
I've told that story multiple times.
Oh, it's crazy.
How we did that in medical school and didn't realize that the blue solution on these cotton pledgets that we were saturating them with was cocaine.
Yep. And you kept wanting to do your nose more and more and more.
Yes. No, well, we did. It was like if it were you and me, you were my lab partner.
Mm-hmm.
I would take the blue solution, soak the cotton pledget, put it in with these long forceps on both sides.
Okay.
Oh, no, that's not right. I would just do one side because I was just going to stick the thing, the fiber optic scope, down one side to look at your vocal cords.
Gotcha.
And then we'd let it sit there for a few minutes while you're absorbing cocaine into your system. Then I would pull it out, do the procedure, and then you would do it on me.
Okay.
And then I would do it again on you.
Okay.
And then you would do it again on me. You see where this is going?
I do. My turn.
So we did it like 5 or 6 times. And by the end of it, we were high as a kite on cocaine, pharmaceutical cocaine, and didn't know it.
Yeah.
And I remember going down to do afternoon rounds, and it was like, why is round so much fun today?
How crazy is that?
It was nuts. Now they use phenylephrine more than they do the methyl ecogoniine or whatever it is. The chemical name for cocaine. Methyl 1R, 2R, 3S, 5S, 3-benzoyl, 8-methyl azabacyclooctane carboxylate. Well, that's not what I want. Anyway.
That's why they call it cocaine.
Yeah. Right. Hence the name.
Yes, hence the name.
Well, anyway. All right. I can't find it.
It's a hell of a drug.